and he joins us live now. Dr. Mobley, thanks for being with us.
Thank you for letting me get this essential message out, John.
Well, it's incredibly concerning to a lot of folks, especially from what we've heard from the CDC and a change of tune, so to speak. You've said in the past the CDC is asleep at the wheel when it comes to handling Ebola. I mean, we've heard about this disease before. It's not exactly new. Why has the CDC been so slow to come up with a good plan to at least make America feel like we are protected?
You know, 10 days ago, the White House came out and said they've been working on this for 7 months. Well, you think they would have figured out what to do with all those 55-gallon containers of Ebola hazardous waste that sat outside Emory University for a week? You think they would have figured out what to do with Mr. Duncan's extended family members that sloshed around in urine and vomit and blood-soaked carpets for a week. And the very day I pulled off that single one-man call to action, that stunt in the Atlanta airport, pointing out that no fever screening was going on and arriving passengers internationally, the same day the White House said, Dr. Fauci of the CDC said, they're not going to do it, it's cumbersome, and it wasn't going to happen. But 2 days after that public outcry, they started febrile screening, and thank God they're doing it today. If they've been planning on doing nothing till a crisis arises, just like ISIS in Iraq, sir.
And all those things that you just mentioned there makes one think, you know, they really don't have a handle on this. And why should we believe the CDC when they say you cannot get ISIS from the air? What's your take?
Ebola from the air.
Ebola, I'm sorry.
That's another thing.
Yes.
There's a huge disconnect from what we are hearing from them and from what we know. Finally, last week, they upgraded the contagion from it. They used to say you have to touch to get Ebola. Now they're saying you can get it from 3 feet away. That sounds pretty airborne to me. It's just a matter of time before clusters start showing up in America and the American public, John. We have 1 million people on the continent of Africa quarantined for Ebola right now, and 10,000 people leave West Africa every single day on 35 non-stop flights around the world. The first missionary doctor that got Ebola, Dr. Kent Brantley, said Ebola is a fire from the pit of hell, and those embers are spreading around the world, every continent as we speak. And believe you me, Mr. Duncan is not the only one to get it. Now here's the point. We might be able to, and Lord knows, let's hope and pray we can contain this cluster that started in the healthcare workers in Dallas. But what happens when this gets into Mexico City? What happens when this gets to my beloved country of Guatemala? The CDC is not going to be flying in plane loads of people like they're still doing today into Dallas. It's going to consume every third world country just as it has West Africa, because they have a deplorable healthcare system.
Well, let's go back, Dr. Mobley. I wanted to talk about something that you brought up just a few moments ago, and that was this 3-foot radius, I guess you could say, that the CDC is now admitting can be a impact zone, if you will, for Ebola. Does that work because maybe somebody sneezes and it gets into the air in some sort of droplet of your snot or something like that? Is that how that would happen?
Of secretions, yes, sir. You know, it's a hemorrhagic fever. You're bleeding from your orifices, you cough up your lungs, you excrete your intestines. It's horrible, and you're essentially a bomb of virus and blood. And for darn sure you can get it from standing in front of someone. But you know what? The very guy that wrote the book on Ebola, Dr. Robin Cook, he said a few nights ago on national TV, he doesn't know how it spread, and he doesn't think anybody knows how it spread. For the CDC to come out and blame the healthcare workers for a breach in policy and procedure is just reprehensible. We don't know everything about it, and for them to say otherwise is just not true.
Well, sir, we only have about a minute to go before we take a short break, but we'll continue the conversation after that. But I wanted to get your take real quick. Of course, we saw some video of you wearing one of those hazmat suits, and we've seen different hazmat suits in different situations on some of the planes. But not every place has a hazmat suit that's rated for a disease like Ebola, right?
The Dallas Presbyterian Hospital, they weren't covering the necks. They told their healthcare workers to use tape around their neck. That's crazy. We should have been having policy, procedures, and protocols in place long ago, and we should be doing drills, not flying by the seat of our pants. The CDC is asleep at the wheel, and individual municipalities have to figure this out themselves. We can't rely on the government.
All right, well, we're seeing more video of Dr. Mobley there at the Atlanta airport, a protest to raise awareness about what is really going on. And after the break, we're going to have more with Dr. Gil Mobley, a microbiologist and an emergency trauma physician, coming up after the break. What is the CDC not telling us when it comes to Ebola? More on that and much more on America's Forum after this short commercial break.